Good morning. I'm Nancy Bush, one of the incident commanders at the Clackamas County's Emergency Operations Center and the Director of Disaster Management. Today is Friday, April 10th at the Operations Center, and we are fully activated. We're here working to protect you and the health of our community. We're responding to community questions, providing resources to cities and fire districts, and spreading the word about how you can keep your family safe. This week, we have ramped up our efforts to reach out to vulnerable populations, including the unemployed, LGBTQ+, the houseless, veterans, seniors, and people in situations dealing with domestic violence and substance abuse. Currently, the state of Oregon has 1,321 cases of COVID-19. There are 109 in Clackamas County, and 3 of our residents have died. Since last week, the CDC has changed its recommendations on wearing masks in public. We're hearing a lot of questions about how to get or make a mask, how to wear it safely, and when and where to use it. The main thing to know is to still stay 6 feet apart. The goal of wearing a cloth face covering is to avoid transmission of the virus between people who are not showing symptoms. The cloth face coverings recommended are not surgical masks or N95 respirators. Those are critical supplies that we need to keep for our medical, first responders, and healthcare workers as recommended by the current CDC guidance. The good news is that physical distancing is working. Projections say that the number of COVID-19 cases in Oregon should reach its highest point on April 22nd if we continue to work together as a community. That means staying at home except for critical trips like to the store, pharmacy, or to get gas. When the weather warms up, many of us want to go outside, but please remember that we have to stay at least 6 feet apart. Make sure you're avoiding group sports, hiking on crowded trails, social gatherings, and unnecessary travel. I encourage you to get out a tape measure to see what 6 feet really looks like. It may be a larger distance than you think. Please note that local fire districts are asking the public to voluntarily stop outdoor burning to help protect vulnerable populations. Smoke inhalation can cause upper respiratory symptoms, which could be incorrectly attributed to COVID-19 and could cause unnecessary testing. Scammers are out in full force, trying to take advantage of the fear people have regarding this pandemic. Please do not give out any of your personal information to anyone over the phone or on the computer. If they tell you they're your bank or a government agency, hang up and call them back. In closing, we know as a community and individually we've been dealing with sheltering in place, lack of routine, school closures for over a month. If you're struggling with this and need someone to talk to, please know that our crisis line is available 24/7 at 503-655-8585. Thank you and be well.